Our final mini lecture in this series of mini lectures about childhood and adolescence disorders is going to cover intellectual development disorder. So the term mental retardation has been replaced by intellectual development disorder in the DSM-5. So in order to receive this diagnosis, an individual needs to display general intellectual functioning that is well below average in combination with poor adaptive behavior. So the IQ must be 70 or below, and the person must have difficulties in areas such as communication, home living, self-direction, work, or safety. And the symptoms must appear before age 18. So in terms of assessing intelligence, educators and clinicians administer intelligence tests to measure intellectual functioning. These tests consist of a variety of questions and tasks that rely on different aspects of intelligence. An individual's overall test score, or intelligence quotient, IQ, is thought then to indicate their general intellectual ability. So in taking a look or making this diagnosis, the clinicians cannot rely solely on this test of intelligence, and in particular on the cutoff score that they have set at 70 to determine whether or not an individual suffers from intellectual development disorder. For proper diagnosis, clinicians should observe the functioning of each individual in his or her everyday environment, taking both the person's background and the community standards into account. So what are some of the features of intellectual development disorder? The most consistent feature is that the person learns very slowly. Other areas of difficulty are attention, short-term memory, planning, and language. Those who are institutionalized are particularly likely to have these limitations. So when we look at intellectual development disorder, there is a breakdown in terms of categories or levels. Mild, which is an IQ from 50 to 70. Moderate, which is IQ 35 to 49. Severe, which is an IQ of 20 to 34. And profound, which is an IQ below 20. So what are some of the causes of intellectual development disorder? So taking a look first at mild intellectual development disorder, the primary cause is environmental, although biological factors may be operating in some cases. When we take a look at moderate, severe, and profound intellectual development disorder, those causes are primarily biological, although people who function at these levels are also greatly affected by their family and their social environments. So when we take a look at these biological causes, we can look at them in terms of three main categories. The first is our chromosomal causes. And the most common chromosomal disorder leading to intellectual development disorder is Down syndrome. Now, fewer than 1 of every 1,000 live births result in Down syndrome, but the rates do increase greatly when the mother is older than 35. Several types of chromosomal abnormalities may cause Down syndrome, but the most common is trisomy 21. Fragile X syndrome is the second most common chromosomal cause of intellectual development disorder as well. There are also some metabolic causes. In metabolic disorders, the body's breakdown or production of chemicals is disturbed. The metabolic disorders that affect intelligence and development typically are caused by the pairing of two defective recessive genes, one from each parent. Some examples include PKU and Tay-Sachs disease. And then finally, we have our prenatal and birth-related causes. As a fetus develops, major physical problems in the pregnant mother can threaten the child's healthy development. For example, low iodine-5 cretinism, alcohol use, which leads to fetal alcohol syndrome, and then certain maternal infections during pregnancy, for example, rubella and syphilis. And then finally, birth complications can also lead to it, particularly if there is a prolonged period without oxygen or anoxia. Taking a look further at some additional causes, there are some childhood problems that could result in the disorder. After birth, particularly up to age 6, certain injuries and accidents can affect intellectual functioning. Examples include poisoning, serious head injury, excessive exposure to X-rays, and excessive use of certain chemicals, minerals, and/or drugs. For example, lead paint. In addition, certain infections such as meningitis and encephalitis can also lead to intellectual development disorder if they are not diagnosed and treated in time. So what are some interventions? The quality of life attained by people with intellectual development disorder depends largely on sociocultural factors. Thus, intervention programs try to provide comfortable and stimulating residences, social and economic opportunities, and a proper education. So when we think about the best educational programs, we know that early intervention seems to offer great promise. So educational programs for individuals with intellectual development disorder may begin during the earliest years. There's also the ongoing debate of special education versus mainstream classrooms. In special education, children with intellectual disability are grouped together in a separate, specially designated educational program. Mainstreaming places them in regular classes with students from the general school population. Quite honestly, neither approach seems consistently superior. And one of the key factors that appears that seems to play a role here is teacher preparedness. Many teachers will use operant conditioning principles to improve the self-help, communication, social, and academic skills of individuals with intellectual development disorder. And quite often, token economy programs are put into place. So how do we know when therapy is actually needed for an individual for a child who is living with this disorder? So people with intellectual development disorder sometimes experience emotional and behavioral problems. Some suffer from low self-esteem, interpersonal problems, and adjustment difficulties. These problems are helped to some degree with individual or group therapy, and psychotropic medications are sometimes prescribed and may be helpful. So how can opportunities for the personal, social, and occupational growth be increased? People need to feel effective and competent to move forward in life. People with intellectual development disorder are most likely to achieve these feelings if their communities allow them to grow and make many of their own choices. Socializing, sex, and marriage are difficult issues for people with intellectual development disorder and their families. However, with proper training and practice, individuals can learn to use contraceptives and carry out responsible family planning. Finally, adults with intellectual development disorder need the financial security and personal satisfaction that comes from holding a job. Many can work in sheltered workshops, but there are too few training programs available. additional programs actually are needed so that more people with intellectual development disorder may achieve their full potential as workers and human beings. So this mini lecture covered our last disorder that we are going to focus on in terms of children and adolescents, and its intellectual disability disorder.